Hello everyone. Today's discussion is going to focus on the path of a tissue biopsy in histopathology lab. To begin with, histopathology is study of tissues affected by disease. And we have various diseases that can affect the tissue. And one of the diseases or illnesses is cancer. So for us to identify cancer in a tissue, this tissue must undergo various steps so as we can give proper diagnosis. And one of the key steps is fixation. Fixation is aimed at preventing post-mortem changes, which are changes that occur upon blood interruption. The second step is specimen reception. This specimen must be received in the lab, and upon reaching the reception area, different things are noted. One of them is age of the patient, the site where the sample is collected, and so many other things are taken care of at that step. The third step is decalcification. Decalcification is aimed at removing calcium from tissues. Not all tissues contain calcium. However, if a tissue contains calcium, this calcium must be removed because presence of calcium usually interferes with the step of microtomy. The fourth step is cut-up or grossing. Grossing is aimed at picking a small piece of tissue from the gross specimen that can aid diagnosis. And on top of that, during grossing, the macroscopic appearance of a tissue is taken care of. The other important step is tissue processing. Tissue processing ideally takes three steps. One is dehydration, which is aimed at removing water from tissue. The second one is clearing, which is aimed at removing the dehydrating agents. And the third one is infiltration. The next step is embedding, which can be called casting or blocking. At the step of embedding, we are aiming at coming up with a tissue block. However, the most important step during embedding is tissue orientation, as we shall have an insight in our subsequent discussions. After embedding, the tissue is taken for microtomy. And during microtomy, we are aiming at producing thin sections from the tissue that was obtained during grossing. And from microtomy, we do floating out. Usually during grossing, during microtomy, sometimes tissue will develop wrinkles. And during floating out, we're trying to flatten this section. And lastly, we go to staining. So staining is aimed at imparting color into the tissue or the section that was obtained during microtomy. And by imparting color, we are able to stain different parts of the tissue, and these different parts can easily be read or seen under the microscope. So in our subsequent discussions, we're going to look at these steps in details, from fixation, what is fixation, up to staining, and what are the appropriate stains that are used in histopathology or in histology to be specific. Thank you for listening.